Well, joining me to discuss this is Noel Bell, a clinical psychotherapist and former social worker. Noel, really appreciate you talking to us this morning. Jodie's story in Adele's report appears to be one that is far too common.
Yes, and increasingly what we're seeing is the need for early intervention, and any the delay in waiting times, even before assessment or after assessment and before treatment, only increases isolation and a sense of panic and a sense that people are not being heard.
The new measures include a senior mental health leader in every school, a 4-week waiting time for NHS treatment, and an extra £300 million over the next 3 years, a step in the right direction, but Labour says it's not enough. Would you agree? NHS
has traditionally been a political football, and I think a lot of clinicians would argue that historical underfunding has taken place. So additional funding need to be seen in the context of underfunding. What has to be welcomed is the increased initiative in the healthy healthcare, health promotion campaigns in schools, because that will aid early diagnosis. What's a great saving for the economy and for the NHS in general is if we get in earlier. Some lifelong mental health conditions, they first start appearing at age 14. So if we can start getting in to early prevention programs, all the better.
On the point of the 4-week NHS waiting times, can the NHS really cope in areas that are already failing to meet targets?
Well, that's the big question. If the risk is you increase quantity rather than the quality. What we need is good clinical outcomes for people who are suffering. If we're going to concentrate on getting people into assessments who may not have diagnosable conditions, then that's going to potentially skew the figures. And if there's more emphasis on assessments, we then might see a negative impact on people who are existing in service, already in care. So the issue is, can we increase access but also increase the quality? And that's going to be a question for clinicians, for the level of funding, and the jury will be out, I'm afraid, on that one.
Well, you've asked the question. What do you think?
I think mental health services are currently at crisis. £300 million is welcome, but I think it probably needs more funding in order to deal with historical underfunding. The increase in the general NHS budget for next year is 0.9%. That's not keeping terms with real funding, and with the following year it's a neutral increase. So we know that, especially in mental health services, with health promotion campaigns like Heads Together, it's only going to increase demand, and that's going to place more and more pressure on demand, and we need extra funding in order to see an increase in supply.
I don't want to put words in your mouth, but you get the sense that when the Health Secretary says that this is an ambitious attempt to transform treatment for young people, you wouldn't go as far as to say it was ambitious?
Well, I think it's got to be welcome in the greater emphasis on waiting times, but that's largely for severe cases, especially around psychosis. What about all conditions? So for someone who's suffering from anxiety, is there going to be the same emphasis? The parity of esteem needs to be real, and it needs extra funding, and it needs to be all conditions, like it is largely in physical health.
Okay, Noel, appreciate your time. Thanks for joining us this morning.
Thank you.